this daily briefing. I appreciate again the media and trying to help us get the information out to the people of Utah and to let them know where we're at, what we're doing, and what we're planning to do going forward. After our briefing yesterday, I heard one of the commentators talk about, well, we just heard from Governor Herbert, and it felt like a lot of repetition. And I'm sure that it was. I'm sure that people will feel the same way today about repetition because, in fact, we are very single-minded in our goal to, in fact, slow down the spread of the COVID-19 virus. We are single-minded of purpose that we're going to make sure that people understand the plan of action that we have out there and that we're still in that urgent phase. As I mentioned yesterday, we won't rest until we drive down the transmission rate, because if we don't do that, then the health system will be overrun and we will have a significant, more acute problem. So we are single-minded, and we have a plan, and we're going to execute on that plan as we know what will help us, in fact, to slow down and stop the spread of this coronavirus. So let me just repeat what I said yesterday. The next 2 weeks are critical. We want you to stay safe, stay home. Keep safe physical distance from each other. We call it social distancing. The physical distance should be at least a minimum of 6 feet. Wash your hands. Cover your cough, your sneeze. Again, practice good hygiene. And rigorously follow the stay safe, stay home protocols we've outlined and the directive we've given, and the directions of your local health department. If we all will do that, we have a good chance of stemming the tide here on the spread of the coronavirus and slow down the transmission. So with that, I do have a couple of other items I'd like to talk to you about, which I think are important, some updates, and some things we're doing on some of the organizing that's taking place. Let me just mention, too, we're still in the urgent phase, but I appreciate what I see happening in the community out there at large. People are showing great acts of kindness and trying to help each other. That is the Utah way. We lead the nation in volunteerism, so it shouldn't be a surprise that people are stepping up and volunteering and trying to help those who need help. And we need to continue to do that. Government cannot do it all. We need the private sector to step up, and we as neighbors and community leaders and all people to see what we can do to find our role and make sure that we help things to happen. I want to give a shout out to our teachers. This has been a very difficult time for them as we've closed down the public education system. Most people are now practicing homeschooling, and our teachers are doing such a great job of making sure that our students at all grade levels are still learning. Again, it's a difficult situation, but they're making sure assignments are out there. They're making phone calls to check on their students. The principals are following up. And again, I appreciate the hard work and dedication that our teachers and those in education are exhibiting in very difficult and trying times, something they've never been trained for. And they're doing a great job. So if you have an opportunity to talk to our teachers and our education people, tell them thanks for the job they're doing. This is really important for us to continue with the education of our young people. I also like to recognize, again, an effort in our private sector. Dean Taylor Randall of the Eccles School of Business, who's the dean there, Mike Levitt, former governor and former secretary of HHS at the federal level, working alongside the George S. and Dolores Dory Eccles Foundation, which is helping to underwrite this effort, for creating what is, in fact, a free online course that starts this Friday. This course is designed to help small businesses in particular weather the storm. And the name of the course is Navigating COVID-19, How to Save Your Business. Now, again, this is free of charge. You can go there, and you're going to learn some practical tips on what you can do to help tread water during this difficult time and maintain steps to take right now to position your business to be able to take advantage of the recovery, which we know is in the future. and it's not that far away, but you've got to be able to get from here to there, and they're going to give you steps on how to position your business to take advantage of the recovery. Where to get immediate business assistance today. Again, as I mentioned yesterday, help is on the way, and not only from the state, but from the federal level and our local banks and a coordinated effort. Where you can get some immediate business assistance is going to be an important aspect for our business community. And what sources of information should you listen to? One of the things that we've had of almost a cottage business out there, people having theories and making comments and opinions, and sometimes it's hard to separate fact from fiction. So for our business community, they need the facts. They need to know what information they can rely on to help them weather the storm and emerge stronger than ever. They have a web page you can go to. We'd like to have that put out there. Information at eccles.utah.edu. Let me give that to you again. Information at Eccles, ECCLES.utah.edu. I think you'll find that very helpful. Testing continues to be the biggest challenge we face. I've mentioned this probably every time I've had a press conference. It is the challenge, and it is also the solution if we can get enough testing done to help us find who's got the coronavirus, how we can isolate them and protect the society and protect them and help them get cured. So testing is key. It's not only just testing, but it's also what we call tracing or tracking of the people and those who've been in contact with somebody who's been exposed to COVID-19. So testing and tracking and tracing are going to continue to be top of our list of needs. I'm encouraged. Some of you have heard already about the new test that can give you an answer in less than 15 minutes that comes from Abbott Laboratories, rapid test of the COVID-19. The good news is that we have 15 of those machines on their way to Utah. We're grateful for that. We are. But in order to manage expectations, let me just tell you that only allows us to test about 100 more individuals. 100 is all. That's really kind of a drop in the bucket. Now, again, it's a step in the right direction. The machines are capable of doing more than that, but we've got to have the test kits that go along with it in order to, in fact, start testing more people, which is what we, in fact, need to do. So we appreciate, again, this is a new breakthrough. We think there's going to be others. In fact, I plan over the next day or two to give you more information on what we are doing to ramp up our testing. Good news here yesterday, we had the largest number of people tested, and so far, 4,000. 4,000 one day. Again, we're getting closer to our goal of being able to have 7,000 in one day, which we're striving for. So more information on that to come. Let me also just thank those who've been involved up to this point. We have strong leadership in this state. Part of our culture is one of leadership, one of working together in a spirit of collaboration and cooperation. So I thank those who've been involved in the beginning of this. You know, we think it's only been really a month we've been involved in this, and I appreciate particularly my Lieutenant Governor, Spencer Cox, who took on the responsibility of our community task force. It was a 24/7 round-the-clock effort, and he's been able to marshal the public and the private sector together to work together. And really, the efforts that they've done in that community task force has helped us to buy some time, to get us in the right place so that we can, in fact, have a good front in fighting this coronavirus, and time for us to mobilize and develop a more effective plan than we've seen really in other states. So for all those involved with the community task force led by Spencer Cox, our Lieutenant Governor, I appreciate the good work they've done to help us get to the good place we're in today as we continue to move forward. In addition, we have good state leadership in other areas I want to mention in particular as we work together. This is a part right now in the urgency phase, which I'll call the surge. We're going to try to surge and move more and more efforts towards getting on top of this coronavirus. And this surge in a coordinated effort and all hands on deck. I appreciate the good work that's coming out of our Department of Health, led by Dr. Joseph Miner. He's a very capable leader. He's an actual physician, a doctor, and certainly has great management skills for that department. He came from local health departments before he took over the responsibility of the state. Unfortunately for Dr. Miner and for us, is he has his own health issues right now with his own immune system having nothing to do with COVID-19, but it makes him a little more susceptible, and so it's a little more difficult for him to be out. He is actually at home at his house and managing things from his home, not being able to come into the office, having to telecommute, as we encourage others to do the same. But we need to have boots on the ground kind of an effort here, particularly out of our Department of Health, as we take this on and surge in our efforts towards more and better efforts. And so today I'm announcing that I've appointed former Adjutant General Jefferson Burton, who led our National Guard here and just retired a few months ago, to lead the day-to-day operations of the Utah Department of Health. General Burton has got a significant background, not only in the military, but in disaster planning and response. So his abilities and training will make him ideal to come in and help us ramp up this surge effort, certainly through the Department of Health and coordinating other efforts that we have going that I'll talk to you about here in a minute. Dr. Miner will remain as the Executive Director of our Health Department, but these ongoing efforts will be directed by General Jefferson Burton, and I'm excited, again, with the cooperation and consultation of Dr. Miner to have this new augmentation in our Department of Health. And General Burton will be part of what we will be known as our Unified Command. I hope everybody understands we do have a unified command. We have an EOC center, Emergency Operations Center, here in the Capitol. It's designed to have these kinds of efforts made. It was operated when we had the earthquake, and we have our most critical players when we establish a unified command. That means all department heads, all the resources we have in state government are brought to bear in a coordinated efforts to see what needs to be done and how it's going to be done and who's going to do it. So this unified command really is what we have now, with the disaster being the COVID-19. And so we're working together and have the critical players from our Division of Emergency Management to our Department of Health and other agencies that will be part of this effort. We've gone to level one. Level one means that all agencies are involved, and we have briefings daily, every morning. We'll use all the resources at our disposal to, in fact, defeat the spread of this coronavirus. The objectives of this unified response are these. One is health. We want to have increased testing and tracing, tracking. We will find and we will deploy PPEs, personal protective equipment, which we have in short supply around the country. But we're going to find and deploy PPEs as we need them. And we're going to plan for any kind of increasing hospital activity level. Again, we've suspended elective surgery so that we have beds available for the increasing numbers that we, with testing, will bring to us, and those who are sick and need health care. Again, that's part of why we want to make sure we don't have our healthcare system overrun, and that's particularly true about our hospitals. So that's the health aspect. Second area is economy. We have a plan. Utah Leads Together, which has been the work of many, coming together with a plan that will in fact work. It's a plan for not only protecting our health and the recovery from the health aspects of COVID-19, but also put us on a track to recover economically. We know there's a downturn in the economy. That's unfortunate, as a result of this coronavirus pandemic. But we are also planning with our plan how we can survive through the middle part of this and, in fact, come out healthy on the other side. Number three is information and communication. We will coordinate all of our efforts to communicate to all the stakeholders involved and certainly to the public to make sure that you're informed and that you're involved. This is everybody working together in a coordinated effort if we're going to end up winning the battle over the coronavirus. And I think, again, we're doing good things. I feel good about the future. I'm optimistic, but we certainly need to work together to make sure we do the things that are necessary to get on top of this. Last of all, I've asked our Department of Public Safety Commissioner, Jess Anderson, who's our Public Safety Commissioner, and I've asked him to lead this unified command. It'll be his job to make sure that all the stakeholders are involved, that we in fact work together in a coordinated effort. So I've asked Commissioner Anderson if he'd step forward and tell you a little bit about what's going on with our unified command. So please welcome Jess Anderson, Commissioner of Public Safety.
Thank you, Governor. Appreciate the opportunity to be here today, and as well as the great efforts of Dr. Miner and the Health Department, and being able to work with Dr. Miner over these last several weeks in all aspects of this health crisis that we find ourselves in currently. And welcome to General Burton, and we look forward to working with him out of the Unified Command and being able to continue to help move things forward in a positive direction here. As Governor has mentioned, we've established a unified command out of the State Emergency Operations Center, which is located here at the state capitol. This is where we put our most critical players up to the table to make the decisions, and as well as policy recommendations up to the governor every single day. These are the brightest of minds, those who are dealing with this from the Health Department, also Public Safety, our Division of Emergency Management. We also have the Utah National Guard, state purchasing, and as well as the Governor's Office of Management and Budget, as well as other stakeholders that come from the state entity. In addition to, we also correlate with the federal government at this level. Particularly, we have a FEMA representative who sits in the State Emergency Operations Center with us, to which we correspond with every single day. The level 1 activation just simply is an opportunity for us to leverage resources. Level 1 means that we now have the ability to draw upon state resources, but as well as federal resources going forward. In fact, later today, we will be declaring, or at least putting forward, the state's major disaster declaration to the President of the United States. This, again, would open up opportunities for us to use resources at a federal level, along with logistics, but also fiscal responsibilities that can come as an assistance to all of us out of the federal levels. Just to reiterate, this opportunity to be working side by side with the Department of Health, as well as every stakeholder on the private side and the public side out of the Emergency Operations Center, is the opportunity that we need to continue to have the flexibility, as well as making progress in every single area. The Governor covered our priorities coming out of the Operations Center, which is first and foremost our health component, where we are doing our very best at tracking the testing mechanisms, our tracing where the vulnerable virus is being spread, but also all of our protective equipment known as PPE that you've heard so much about. We work hand in hand with our economic task force led by the Salt Lake Chamber and those in the private sector and the businesses of understanding essential services and going forward with what is known to be driving our economy. And most important is an information hub. The Operations Center serves as a key component of gathering proper and significant data that drives us in our decision making, as well as the policies that are coming out of everything that we do. It is important that we all share that information as we, from the state perspective, work with the counties and the locals, their emergency managers, as well as their health offices and those locations. It's critical that we have the proper data that's driving the decisions that we're making. Some of the things we've been able to accomplish so far in the last couple of weeks working out of the command center, this unified effort. We have communicated with and brought home some 37 Utahns off the Grand Princess cruise ship, those who have been stranded abroad as well. We're identifying and securing quarantine sites. We're in constant communication with the public. It reminds you why we need you to continue to social distance and stay at home, the messaging that the governor has pushed out. We are arranging for personal protective equipment donations. So far, we've been receiving donations here in the Wasatch Front. We've got 3 collection sites, and we encourage that private sector that still wants to contribute to go through those donation platforms, both as we've seen, both in a fiscal aspect, but also in actual physical donations. We continue to coordinate among our state and our local partners. That is a key component of making this successful throughout the entire state. Every day that coordination is going out, and 3 times a week we're on coordination calls with our county officials to be able to make sure that messaging is appropriate. We continue to identify emergency funding sources. As I mentioned, filing or declaring our major disaster is one of those areas that we can rely upon, or at least ask for some of those funding resources from the federal government. We've been able to translate several public materials and documents into Spanish, but also other languages, which has been very key and critical for the operations to go forward to reach all of our platforms, and including having the American Sign Language interpreting here at our press conferences. We've also been able to provide advice to the private sector and their businesses, as I mentioned, working with the economic side of the house. And of course, we continue to track the spread of the disease, working with the brightest of minds and the doctors who are in place within the medical industry, tracking as well as updating on projections of what that begins to look like for us here in the state. That's just a few of the daily operations of what's happening coming out of our Emergency Operations Center. I can tell you that things are moving very quickly. We are in an urgent phase. We have just but hours sometimes, but also days that we're trying to get on top of this, trying to come up with solutions and trying to present the best policy moving forward to make those decisions that need to be made to protect all of us here in the state of Utah. Thank you.
Thank you, Commissioner. Again, just a reminder that you can get additional information, a lot of facts and questions answered, and instruction on what to do, to go to our webpage at coronavirus.utah.gov, coronavirus.utah.gov. With that, we have a couple of minutes for some questions, if you have any questions.
Yeah, Governor, there has been a call lately for people to contact your office about the idea of a possible rent freeze or eviction freeze, particularly in the month of April. Any thoughts on that? Is the state looking at that?
All things are on the table, Ben, to see what we can do to help employers and employees, certainly renters and landlords. We hope that there's opportunities for them to work together to maybe give some forgiveness or delay the payment of rent. We understand that landlords sometimes have mortgage payments, though, that they've got to make. They rely on the rents to enable them to make those mortgage payments, not have the bank foreclose, which adds another third party, and that is our banks and financial institutions that have the mortgages on these properties. Again, we've talked to some of the banks, I have personally, that are willing to, in fact, forego foreclosure and give some grace periods of time on the mortgages. I expect that when we come into a special session, which I think will be necessary here in the next few weeks, I'll work with the legislative leadership on determining a time. But as we come into to address budgetary issues with the slowdown of revenues, the postponing of the filing for income tax, for example, your taxes on April 15th have been moved to July 15th as we mirror what's being done on the federal level. There's other discussions which will occur on tax policy. So that discussion is certainly on the table. No decisions have been made, but maybe in the next 2 or 3 weeks there might be some issues there. Last but not least, what I think is going to be more helpful, at least certainly as helpful, is going to be the relief package from the CARE Act from Washington, D.C. There's going to be significant monies in there to help with small business, to help keep businesses afloat so they can continue to employ people and not have to lay off those employees. And if we do that, I think that's a better way to keep the economy afloat during this tough time. And it gives a blanket overall approach to help businesses and employees at the same time. So I expect you're going to see more about that in the programs available. Again, I'll remind everybody, our workforce services, the director there, John Pierpont, is prepared to help people, employers, employees, with the challenge they face economically, to help them line up with programs and give them personal assistance. Next question.
Hi, yeah, I wanted to ask about the transmission rate. Governor, when you announced the Utah Leads Together plan a week ago, I believe the transmission rate was around 1.5. So I was wondering if it's still around there, or if you know what that transmission rate is currently, and if you're still expecting the urgent phase to, I believe it was supposed to last another 6 to 12 weeks or so. Is that still kind of the time frame you're looking at?
Yes, I don't think it's changed much. We are doing the data analysis. Our epidemiologist, Dr. Dunn, might have more information. She'll be here later today to give her report. Working with our Office of Management and Budget. Again, part of this effort is to see exactly what the transmission rate is. We hope to get it down below 1. That means that we'll start shrinking the number of infections out there. We want to get down to 1 to 1 or 1 to 0.6. That's when you start turning it down. 1 to 1.5 means we're increasing, which is not what we want to have done. We do believe that right now, for everyone that we've tested and found to have the infection of COVID-19, there's probably 5.5 others out there who have not been tested. So if we have, whatever we have out there, 1,000 people have infection, there's probably 5,500 out there that really do have it that we don't know about. We have not been able to test. So again, if you have symptoms, we want you to get tested. We have the capacity now to test people that have the symptoms. Don't hesitate. Contact your healthcare provider, your doctor. Go to an Instacare place. Call them. They will make arrangements for you to be tested immediately. That's an important aspect of what we need to do and be responsible. And we have that capacity, which we're building up to be able to handle those who have symptoms. We'd like to get to the point where anybody who wants to be tested, just as curiosity to say, am I okay? We would like to get to that point where everybody could be tested. That's when we'll really get a handle on the spread and stop it from happening. But I expect that we're probably about the same number. I hesitate to say it's getting better until we have the data to back that up. Any other question? If we have a business, if I understand, we have a business that has somebody that has COVID-19, what's the proper protocol of a business to shut down, or what do they do? Certainly what has been happening is they need to work with their local health department. They're the ones that really have the ability to give you a clean bill of health. And most businesses, in fact, go through a very significant sanitation effort. And some, like our airlines, are fogging the plane. They actually, after every flight, fog the plane and wipe it all down. If we have a business that has somebody that's exposed, we track and trace the people who have been exposed to the person that's been exposed to COVID-19 or has the coronavirus, and they will all be tested. And then the businesses needs to go through and clean out, make sure wherever they've been and wherever they've been exposed to, that has been wiped down with Clorox sanitation napkins to make sure that it's safe for people to come back. Again, this is an effort we all need to embrace. We need to exhibit patience because it's disruptive to the business and maybe the customers that needing help. But we need to have first and foremost the protection of the health and welfare of the people. If we do that, then the economy is going to come back. So they again are joined to the hip. It's not one versus the other. So work with your local health department, follow good common sense and hygiene practices, and you'll be able to keep on with your business. Any other question?
Hey, I was just wondering, the command operation is supposed to be helping to deploy protective equipment. Do you think that you will have enough to give to people who aren't necessarily in the medical field, such as law enforcement?
Okay, Commissioner Anderson? Hear that?
So if I understand the question, it has to do with our personal protective equipment and in relation to the stockpile that we are collecting here at the state level and how that gets deployed out. I can tell you that, as you can imagine, having access to all of that necessary equipment and or protective gear has become very hard to come by at this point, as it's called upon throughout the world. Having said that, we have received a couple of shipments from our FEMA counterparts from the national stockpile, which they have shared with us as that comes into them. But yet it is very small in number for what we need here in the state of Utah. There is a process that is in place that we use to be able to push that out as needed. And that really goes first and foremost just because of the demand of PPE within our healthcare system right now is taking priority of that need for coming from our own local stockpile. 80% of it goes to our healthcare. 20% of it is then going to out to the rest of the counties as well as first responders. And so that having the ability to start to provide that for general public right now is not going to be an option for us until we can continue to get some of our shipments in that we're expecting.
Let me just add to that this little factoid. One, we have 27,000 masks, and we need about 2 to 3 million. So we have short supply, certainly in that area. We're working with the hospitals. Some of the material that's used for masks, for example, and other PPEs is material we already have and are using in hospitals that are used and then discarded. We're working with the hospitals to see if we can, in fact, use that and have some of it recycled, maybe to make additional masks. So the hospitals are stepping up, seeing if they can help bring material that we can create some of the PPEs with in a recycled fashion. So we're looking to be innovative and creative to see if there's ways we can, in fact, address the shortage. Again, I know it's a national issue. It's not just a state issue. We were on the phone here just yesterday with the president and the vice president talking about that very thing, and they understand this is really a high priority for the states. We've got to have more PPEs. So hopefully we're going to get some relief on that as we move forward over the next few days. One last question.
Yes, when we've talked to Dr. Dunn about is there any way to track how many people have recovered from the virus, she says the state really doesn't have any kind of system to track that. What do you think the chances are that we could create one? Because the way that the numbers are coming out now, sounds like people are just getting sicker and sicker, and we're not learning about the people who have gotten better.
Hey, great question. This is Commissioner Anderson. So out of our operations center, we are currently focusing our efforts on tracking the current cases, but also something that's on our radar is to begin tracking and knowing that we need to be very mindful of what you just mentioned here, of those who have recovered from the COVID virus. And so that is definitely something that's on our radar of one of our for lack of better terms, of one of our dashboards to begin to track and with real-time data.
Let me just add to what Commissioner Anderson said. Clearly having good data is important for us all. That has the certainty of the information, the data it gives us is a critical issue for us. We're trying to refine that. Part of the challenge we face is that there are some out there that have had the virus that didn't even know they had it. They've had a mild form of it. Maybe they thought they had a traditional flu or a cold or didn't even notice. And so it's hard to know how many have had it and recovered. But that's part of the challenge we face in getting the data accurately, and the testing that we need to have done are all component parts of that to give good information to the public so they can be confident that we're doing everything that can be done. I'm confident we're doing everything that can be done. And really this is a coordinated effort of really everybody working together And if we do that, we're going to be okay. It's going to be a few weeks of discomfort, but we're going to get to that stabilization stage, and then we're going to go to recovery. And again, it's going to take us all working together to do that. So thanks to everybody for your patience and for all the good things you're doing. Thank you.
Thank you, Governor. I just want to note a couple of items here as we close things up today. First of all, with regard to the online course available through the Eccles School of Business, the best way to get information about that will be by going to Eccles, ECCLES.link/Mike-Levitt. Governor Levitt will be convening that course. And so eccles.link/Mike-Levitt. I also just wanted to note that as far as specific numbers about where we are with the tracking and testing, those kinds of items, we would really refer you to the afternoon briefing that will happen today, 1 o'clock at the Cannon Building with Dr. Angela Dunn. And she'll have the latest on some of those figures there. There was a good question from Max Roth yesterday about where this will be available on the coronavirus.utah.gov website. And there will be good information this afternoon at that briefing about where you can find those numbers. And our commitment is to have a daily breather around 11 o'clock each morning from the governor. We look forward to seeing you again tomorrow. Thank you very much.